HIV impacts millions of lives. It stands for Human Immunodeficiency Virus. It is the virus that can lead to acquired immunodeficiency syndrome, or AIDS. Unlike some other viruses, the human body cannot get rid of HIV. No safe and effective cure currently exists, but scientists are working hard to find one and remain hopeful. Studies show that in the late 1800s they jumped from chimpanzees to a man while they were hunting them for meat. AIDS have been a prominent issue for the last couple of decades. AIDS started becoming an issue in the United States in the early 80s on June 5, 1981. The U.S. Centers for Disease Control and Prevention, the CDC, published a report describing cases of a rare lung infection in 5 young previously healthy gay men in Los Angeles. Within days of this report, doctors from all over the U.S. are flooding the CDC with reports of similar cases. In September 1982, the CDC used the term AIDS, acquired immune deficiency syndrome, for the first time, and it defined what AIDS was for the first time. The CDC also states that blacks account for almost half, which is 44% of all new HIV infections. Hispanics account for 21% of all new HIV infections, and whites account for nearly 31% of all new infections. According to the CDC, one of the key factors fueling this racial, ethical disparity was economic barriers and a lack of insurance, which can limit access to health care, including access to HIV testing and treatment. In addition to that, they face a higher risk of infection because of the higher HIV prevalence. The proportion of people living with HIV in many African American and Latino communities, which means individuals in those communities face a greater risk of infection with every sexual encounter. And another problem is that a lot of people do not want to get tested because they have a stigma and they lack health literacy. Another troubling statistic was that about 60% of all youth with HIV do not know that they are infected and are not getting treated and can unknowingly pass the virus to others. This disparities and issues with the youth can help be addressed if they were educated that the CDC shows where there are free testing sites, and if they were educated on the fact that people who receive the Affordable Care Act do not have to pay a copay to get tested. According to AIDS.gov, prevention methods of HIV include getting tested and knowing your partner's HIV status, having less risky sex, always use condoms regardless if it's oral, anal, or vaginal intercourse, limit number of sexual partners, get tested and treated for STDs, talk to healthcare provider, and see if PrEP is right for you. And also, do not inject drugs. Unfortunately, there is no cure for AIDS, and there has been a growing HIV cure momentum around the world. However, implementations of prioritizing HIV cure, new momentum to overcome old challenges in HIV suggest the following 3 ways to help continue to enable the HIV cure momentum. The first step is integrating HIV with existing tests and treating priorities will help strengthen existing linkages and prevent the development of false diatoms. The second step is optimizing health systems for early detection of HIV-infected adults, adolescents, and neonates. Would be beneficial for both individual clinical and public health outcomes. Finally, the last step to help continue to enable the HIV cure momentum is the HIV cure global framework, which requires strengthening multi-sectoral linkages between clinicians, policymakers, advocates, and other stakeholders in order to develop a comprehensive plan for curing HIV in the future.